All right, everybody, welcome back, and thanks for sticking around. I've got some amazing news that I'm going to share a little bit later, but I just want to say thank you so much for tuning in. We got a lot of really good comments, so after this next vignette, we're going to go through them, but Sherry, where are we at?
Absolutely. We are about to enter into something really special, and the information that you're going to get, it's really relevant to everybody. But before we get there, I want to take this moment to thank the sponsor of this vignette. It is Juna Sleep Systems, and they're here to help you sleep better with a high-quality mattress. Check it out.
Welcome to Juna. We believe finding the perfect mattress starts with education, not a sales pitch. We take the time to help you figure out the perfect mattress build for you. Then our team goes to work. Every Juna is handcrafted to meet your specific needs, even per side of the bed. Rest easy, knowing you have a 120-night risk-free trial to ensure the highest quality sleep of your life. Juna Sleep Systems, you're gonna love the way you sleep. We guarantee it.
All right, so I just want to say, we have all the docs here at the Kansas City Association, and we were about $700 away from our goal. So I basically said, hey guys, let's step up. Dr. Keith Frederick actually, gave 200. Dr. M gave 3, and Dr. Cleveland finished it off for us. So we've hit our 30,000 mark. Let's go, high five.
High five.
Let's keep going though. Let's see what we can get to on the rest of this. Our next vignette guest is going to be Dr. Laskowski. A Mayo doc, phenomenal, worked
Awesome.
with a ton of different athletes and people. I want you to pay attention to this because this is a really important one. So stay tuned and we'll see you soon.
So welcome back. It's ChiroThon 2026, and we're so excited to have you back. It is a pleasure to welcome Dr. Edward R. Laskowski, a nationally recognized leader in sports medicine and rehabilitation, a former co-director of the Mayo Clinic Sports Medicine, and now professor emeritus at the Mayo Clinic Alex College of Medicine. Dr. Laskowski has built an extraordinary career at the intersection of clinical care, research, and medicine. With residency at Mayo Clinic, he has gone on to earn widespread recognition, including some of the top names. Example, America's top physician and best doctor in America. His service spans from treating athletes as an Olympic polyclinic physician to advising national health initiatives as a member of the President's Council on Physical Fitness and Sports. With hundreds of publications, frequent national media contributions, and a focus on fitness, injury, prevention, and population health. He is a doctor that brings wealth of experience and insight in today's conversation. Welcome to ChiroThon 2026.
Thank you so much, Dr. McAllister. It's my pleasure to be here, and thank you so much for the kind words.
It's fun to have someone like you because we now know we're getting the best of the best. We're getting all of the information straight from the experts like yourself, since you've been in this field for many years. I want to kick it off, especially for those that are listening. Adjusted Reality has a chapter in it. It is called Movement, and it's the quaternary movement: stability, mobility, flexibility, and capability, which is strength training. Oftentimes, though, we can get bombarded with so much noise, and we really need to home in on the signal. I would like to ask you to kick off. First off, how did you go into the sports medicine area? And then how have you seen it evolve over the number of years that you've been in it?
Mhm. Oh, great question. So, well, I always was active, as a kid, but I actually, believe it or not, grew up in Northern Illinois, and I grew up right next to a rope-toe ski hill, and I skied a lot, and actually made it on the U.S. ski team. So I skied a little bit there before college on the U.S. team, and I remember I had one colleague, one friend on the team who's actually later won a gold medal. But he had a very severe ankle injury, and I visited him in the hospital. And at that time, the X-rays were on the little view screen there, and I could see his ankle, and it was all these little screws and plates, and everything was put back together again. But the interesting thing is, his doc came in to see him, and he said, "Okay, Phil," he goes, "10% of the job is done." And I'm like, "What do you mean? You fixed him?" He goes, "No, no. Now you got to do the rehab. Now you got to do the exercise." And I was like, "Oh." So that got me interested in just kind of rehabilitation and conditioning and exercise science. And I went to medical school, as you said, at Northwestern, which has an excellent physical medicine and rehabilitation program, which is my specialty. So was exposed to a lot there, and from there, the rest is history. So,
That's brilliant. There's a saying, and I truly believe it: show me your friends, and I'll show you your future. And it's kind of ironic because here you are learning how to ski, and you're surrounded by people who are completely competitive, competitive enough that you not only made the team, but then your friend won a gold medal. Isn't it the truth, though, when you think back on the people that you surround yourself with? It's a reflection of who we become and what we want to do. And that was one of those moments for you.
very true, very true. And I've been blessed to have mentors in my life and teachers in my life and just people in my life who have just been exceptional people and role models for me. So I always, couch that whatever I have is based on what I have from God, and also what I have from the people that He has blessed me with around me.
Well said. And when we're moving into the exercise realm, you were working with the President's Council on Physical Fitness and Sports. Tell me a little bit about why you got involved in that, and what did you learn that surprised you when you started engaging in this the area?
Well, I do publish a lot and had a lot of media on exercise and fitness, and so this was noticed by some people in the and George W. Bush's administration, and they asked me if I would consider joining the council. I said sure, and after a long background check, I was really blessed to be part of that council, and also President Obama's council. I really have a passion for population health. And as you know, we have a worldwide epidemic of obesity and sedentary lifestyle. About 70% of our nation, overweight, obese, sedentary lifestyle. And it's really affecting so many things. My specialty, I deal with a lot of muscle and joint problems. So if you think of if someone has arthritis and they have they're overweight, the stress in the joints, it's kind of 1 pound you have up above your waist is equal to 4 pounds in the hips and 4 pounds in the knees. So that magnified force creates all sorts of problems and pain and everything. So we really, and you may know the records of our military age men now, only about a quarter are fit to serve. So really we have a global problem. It's a generational problem. And you probably have seen the CDC data showing even from 1980 to now, how we've changed as a country and as a world. I speak all over the world on this. In Dubai, there's 35% of the men, 45% of the women aren't getting their activity. And I've been in Malta, I've been in Czech Republic, I've been everywhere. And so it's really a global epidemic that is affecting quality of life as well as quantity of life. And not to pick, BMI is just a population measure. There's no, not to pick on a number that everybody should be, but it is a measure of how populations are doing, and we aren't doing that well in respect through the whole world in that. And we just want to get people moving for the beneficial effects of movement, because when we don't have that, exercise is medicine, motion is lotion, we say. When we don't have that movement, bad things start happening in our system. Bad things happen with our cardiovascular supply. Bad things happen with our lipids, all those types of things. So we really want to get people engaged and moving. And again, it's not about body shaming or anything like that. This is basically a medical problem. If you have a certain percent overweight, your heart has to work harder. The increased risk of cardiovascular disease is greater. Increased risk of cancer is greater. And when we start moving, we improve a myriad of things. You mentioned again how I was involved in the physical activity guidelines for Americans, and you may be familiar that they first came out in 2008 and were revised in 2018, and they were going to be revised again for 2028. But that was based on thousands and thousands of research, high quality research articles. And those are the recommendations for 150 minutes of moderate activity per week, and 300 if you're trying to lose weight or maintain weight, 75 of vigorous, or 150 if you're trying to maintain or lose weight. But we also recommend for strength training exercise, for flexibility exercise, for stability exercise, because we have an increased incidence of falls as we grow older. So exercise truly is medicine, and it's foundational, and it's better than any pill out there. I mean, we do a lot of research at Mayo Clinic. Our three shields at Mayo Clinic are practice, education, and research. So we do the research. So we have evidence-based recommendations for our practice, and then we can teach those to others and share best practices. I tell you, there's nothing that compares to exercise. And even I have a lot of colleagues at Mayo Clinic who do what we call regenerative medicine. And I always joke with them because nothing is truly regenerative. It doesn't create new. But if you compare what we call the effect size in a study, and that's the degree at which an intervention affects a population, and you take the best studies in regenerative medicine, which we're pouring a lot of money into now, and it's good. It's we need to study it, we need to find out what works and who it works in, and that's great. But if you take those studies, the best studies of regenerative medicine, and compare them to the studies on exercise, the effect size of exercise is 800 times that of regenerative
Oh,
medicine.
that's so beautiful. You have to say that number again because for those of you who are listening and you want to look good, you want to feel good, he just said something that's like the mic drop. Say it again one more time.
Well, again, just simple physical activity, movement, exercise, the effect it's going to have on your life, on your lifespan and health span, is 800 times more powerful than the effects of regenerative medicine, which are the things that you're hearing about: stem cell injections and platelet plasma and all those types of things. So these foundational things, movement, physical activity, clean eating, relatedness, connectedness, social connectedness, faith, all those things are huge and foundationally much more, much better than any pill we've ever developed.
And that's kind of an interesting thing because, as we've seen in the British Medical Journal when they were talking about depression and anxiety, touch a little more because I know we do have an epidemic of anxiety and depression in our youth. And it also happens to be a startling statistic that it's the number one, I believe, maybe even hopefully number two, maybe it slides into that position that suicide is on the rise for our youth. And that is a painful statistic, but it's also a reality that we need to address and we need to come full throttle into that darkness to open it up. And talk to me about the statistics on or share, from how exercise is compared to some of the medications that are on the market.
That is a great point, Sherry. We think about the physical benefits of exercise a lot, which there are, again, myriad. There are tremendous benefits, but there's also incredible psychologic benefits. We've done some research at Mayo that shows that physical activity reduces the risk of dementia, of Alzheimer's disease. People with neurologic disease like Parkinson's, it actually improves their outcome, improves their function. And you mentioned, yeah, our kids are, now technology is king. Kids are on phones a lot. When a lot of us are on computers a lot. Their kids are more sedentary than before because of the video games and computer use and television. And there is an increased incidence in our youth of suicide, of depression, and kids aren't playing outside as much like they used to. So when we also study, we talked about the physical effects. When we study the psychologic effects of exercise and activity, we find that some studies exercise is as good or more effective than cognitive behavioral therapy or medication like Prozac for depression. So instead of, again, taking a pill, when we get people engaged, when we get their bodies moving, we release good beneficial things in the body. You've all heard of endorphins, probably, right? The runner's high. Well, those are real. And when we have physical activity, we release those good chemicals that improve our mood, that actually improve our status. And it was very interesting. I reviewed papers for our journal called the Mayo Clinic Proceedings. And there was one study where they took active people and they made them sedentary for a week. And during that week, they did all sorts of psychological tests, and it's called a POIMS. It's profiled mood states. So they actually looked at depression, anxiety, all that sort of thing. When they were sedentary, when they're forced to be sedentary for that week, all those scores went up. Depression went up, anxiety went up, all those things went up. And then when they got back into activity, they all went down again. So even for that week, it made a difference.
It's so
So
critical because when you think about just how you feel, it impacts everything you do. Your activities of daily living get harder when your pain is there. It actually it increases how you actually feel the pain. But talk to me about sleep because I know oftentimes people they're not getting enough sleep because they are on their technology, and we have this deep REM sleep. How does our movement during the day and our activities, whether it's high impact or a moderate exercise, how does that impact our sleep?
Well, that's a great question as well. We have an activity deprived world, but we also have a sleep deprived world.
Yes.
And we're made to, we need recovery time. So we call it the anabolic or the buildup time is sleep. And lots of people think, oh, I'm just, doing nothing. You're actually doing a ton when you're sleeping. You're actually repairing systems, you're reorganizing systems, you're preparing things, you're sorting out things in your brain and your mind. You're getting that deep sleep, that restorative sleep, releases certain chemicals. You may have heard of, there's a lot of press on a substance called leptin that if we sleep a lot is released, and it actually reduces the incidence of obesity. So when we have high leptin production, so when we don't sleep as much, we have low leptin production, we're more hungry, we tend to gain more weight. So there's a myriad of things that sleep does for us that builds us up. And if we try and short shrift that, and just get a few hours or so, we usually pay, our attention span can pay. And they've done studies on people with sleep deprivation, and they don't think as good. Their critical thinking skills are bad. And in some cases, that's almost like being drunk. if you're sleep deprived, and that's why we got resident hours now for our residents, because we found that, if they're on call and they're up all night and then they have to make decisions the next day, it's not good. It's not good for the patients. They have more increased risk of errors. So now we have duty hour restrictions. We really don't want our residents to be extended to the point where they're affecting their cognitive thinking. So all those things are important. We need to be moving, but we also need to have that time to repair our body and to restore our body.
It's
And
a very good point. We think of our doctors, especially those that are going to be on call, almost like they're superheroes. And we do have to, like the residency programs from the past really weren't effective and probably put a lot of medical doctors at risk for their own health decline, not only their patients in making the choices that they make. So well done on being able to hit those marks, especially as we start thinking about other employer careers. Like, you think about your truck driver, like a semi truck, and he's pushing hard, or she, to get to the next spot. They're lacking sleep, they're lacking movement, so their judgments are going to be off. Their capability to make the best decisions put us all at risk. So I think it's so profound that you bring these types of things up, because on a regular basis, most of us are not adjusting our reality. We're not thinking about the outcomes. And that's why it's so important to have a guest like you. It's the why. Why is it so important? And then the how's going to be up to you as you listen to this podcast. We're with Dr. I apologize at the beginning because, my Canadian wants to slip in. I want to say your name totally different, but it's Laskowski. And you bring a wealth of experience. And one of them is I want to ask you about exercise. Is many people think of it as aerobic, and they rarely think of exercise anaerobically if they've been out of school for a long period of time. Our youth is doing better because they're starting to say strength training is a very important aspect of it. But if you kind of gave a global aspect of strength training and then flexibility, which is critical too as we age, because the more balance we have and the more ability to be flexible, the less likely we are to fall. But can you kind of give a 360 on flexibility, our mobility, and our capability, which is the strength training, for the average adult, perhaps that may have been out of school and maybe remembers that president's sports testing from a while ago, giving kind of the facts on why that 150 minutes is so important, and also why balancing, you can't always go out and do aerobic. You have to be able to balance that with strength training. Can you give an insight into that world?
Oh, great question, Dr. McAllister. Yeah, the 150 minutes, that's again, voluminous amounts of research so that amount really affects our health to the point that it reduces our risk of dying. And that was based on voluminous a multitude of studies. So that's what people may think of the cardiovascular or the aerobic exercise. And it can be as simple as walking. And if you have arthritis, maybe it's biking or swimming, water exercise, things like that. But that gets our heart rate up to a point where you're doing moderate exercise, which is kind of like this. You can carry on conversation, but you're breathing kind of hard. That's moderate. And if you're there, you don't even need fancy heart monitors or whatever. If you're there, you're going to get the benefit. And any amount, any time helps. We used to have a 10-minute limit before. Oh, you have to do something for 10 minutes. We found out with our new revised guidelines, anything helps. So the more you accumulate minutes of motion throughout the day, the better your cardiovascular status is going to be, and the lower your risk of dying is going to be. In tandem with that, as you mentioned, the capability, the strength training, very, very important. We lose about 10% of our lean muscle mass per decade after age 30. And that's all comers, just everybody. It's just our physiology changes. And we can say, oh, I can't do what I did when I was 18. Well, your physiology is different. But the good news is that whatever age we are, we can actually mitigate those effects and actually keep and gain lean muscle. And really, no, I say always, until you breathe your last breath, you can always get stronger. When there was a study with 86 to 96-year-old individuals in a long-term care facility, they put them on a strength training program that they had never been on before. The average gain in strength was 174%. Some gained over 360%. And that translated into not just, oh, those are nice numbers. It translated into they could get up out of chairs they could not get up from before. They could cross the street before the light turned red. Their quality of life improved as well. And for strength training, it actually amazed me as well, because we think of, aerobic is all, helps our heart, helps our lipids, the good HDL and all. But strength training does that too. And in some cases is good or better than aerobics. It helps our blood pressure, both the systolic, the top number, the diastolic, the lower number. It helps our lipid profile. It reduces the LDL with the bad cholesterol. It helps our insulin sensitivity. So as we get older, the risk of type 2 diabetes increases as we get older. So exercise mitigates against that. It makes us more sensitive to insulin so we can control our blood sugar better. So in a myriad of ways, it's helping us. And boy, you put them together, you put the aerobic with the strength training, it's a very powerful effect on our health. And also our function. You want to be able to get up from a chair with ease. You want to be able to function well in life and lift groceries without hurting yourself, all those types of things. So play with the grandkids, play with your kids. Those things all translate into quality of life as well. So strength training, aerobic training, flexibility, I like to call it range of motion about a joint. You want the optimal range of motion about your joints so the muscle can do its work most effectively. And, this is genetically determined, so not everybody can be a ballerina or not everybody can be a gymnast, and that's okay. Some people, doc, I stretch 2 hours a day, it's not doing anything. Well, there may be a genetic limit, but a couple things we find out important are symmetry, so side-to-side equalness. So say you've had a hamstring strain in the back of your thigh, and one side's had it, one side's not. Usually when you have an injury, the muscle heals, it gets a little bit tighter. So, maybe you're lacking as much motion on that tight side. If you are, and you go out running, it may not hurt you the first day, may not hurt you the first month, may not hurt you the first 3 months, but 4 months and 3 days, you say, oh man, my hamstring's killing me. What'd you do different? Nothing. Well, it was cumulative load on that tissue over time because there was an imbalance, and that's going to cause a problem. And you can think of your heel cord, the Achilles tendon too. If you're in a hilly area and that you're supposed to have your ankle go about 20 degrees past the neutral position, if it's tight and it may say goes to 90, but you walk a lot of hills, well, your heel's not accommodating to the slant of that hill. So over time, again, you're going to, oh man, my Achilles is hurting me. Well, that's cumulative load trauma. So we want to ensure that side-to-side balance, most important. Everybody's going to be genetically different as far as that's concerned, and not everybody has to be a ballerina, but we want to have that side-to-side equalness, and we want to have that flexibility of our joints so our muscles can do their best work. So that's important too. We recommend, if you're going to do static stretches, we would recommend them after exercise. When your muscle blood flows increase, you're going to get more of a benefit after your stretch. Before you exercise, we call it a dynamic warm-up. So if you're gonna run, you kind of walk first, then you walk, jog, then you jog, run, then you run. So you're getting your muscles used to what you're going to be doing. You do martial arts and you do a front kick. You do that really slow, and then you take up the pace, you take up the tempo to the point you're doing it as fast as you're going to be doing it during your martial arts. So it gives the muscle, there's all sorts of receptors in our muscle that transmit information. It gives your muscle time to prepare for that and do those types of movement patterns. And then you mentioned the stability, because I think you can be very strong but not stable. You can be very flexible but not stable, and very aerobically fit but not stable. And that, because stability is the way the muscles are used together. I had NFL linebacker in my office one time. Weighed 280 pounds. He could bench press 550 pounds with a bench behind him. But as soon as I got him on one leg, I could push him over with a finger. He was
Yes.
very strong but not stable. So, as you know, the risk of falling increases as we age. So very important for us to get on programs that challenge that in a gentle way. And it could be stand on one leg while you're brushing your teeth. And it doesn't have to be a Bosu ball right away. It can be very simple things to start out. In all of these things, I think one thing we need to entice people into exercise, because they've heard so many things about it, and so many, oh, I got to lift 500 pounds, or, oh, I got to run a marathon. You don't have to do any of those. And as long as we're consistent with what we're doing, and we're starting out slow, that's really the key.
These are such critical things, and I'll tell you, only an expert like you could put it so succinctly into this. Could have been a 3-4 chapter moment right here, and you put it all out there for people to consume. And you may want to just listen to that a couple times as you go through your day, is thinking about what does it mean to be balanced. And one of the things chiropractic does very well is look at the analysis between left and right, or sometimes front and back. And watching people, gait analysis is critical, as you know, is sports. When you see someone who has been injured or is not functioning at full, those are the red flags that potential injuries are on their way. And I love that you brought up Achilles, because that was one of my injuries. And I knew that ankle needed some restoration. And yet I was a little cocky and just thought, nah, I'm good. Let's go. So
Huh.
I do fully appreciate where you're coming from.
When I appreciate, I have a lot of colleagues who are chiropractors and that I refer to me, and it's neat because they'll say, they're working on the things that you mentioned, the symmetry, and they'll see something and say, maybe you better go see doc. There may be something there that they can improve, and that's great. And in the same context, we have some very good interventions by our chiropractic colleagues who can restore that symmetry, look at muscle balance, look at core stability in a way that will really be beneficial to the patient. So I think it's a great team effort there.
And you've worked at really high levels, like watching Olympic athletes and watching people retrain and recover, often injured and then coming back to it. You said something that I think is very profound, that the audience, I hope you picked it up, is recovery really is a key moment as we started this. And people don't often give recovery that much interest, because it's like, oh, the pins are in, I'm good to go, like your friend who is an Olympic skier. And yet when we start to think about the recovery really is that 80 to 90% importance level, and it drives us for the future. I think that's part of where we have to give ourselves almost a little more caring when we get injured, to come back to what we want to do, recognizing the importance of recovery.
I think that's a great point. And we actually work with a group that you may have heard of, Athletes Performance. Before they changed the name to Exos. And I remember Mark Verstappen explaining to me the X in Exos. And I said, why do you have Exos? And he said, there's an X, there's 4 parts. There's the top 2 and then the bottom 2. And he says, those are the foundations of fitness. And he said, one part is physical activity. One part is nutrition, good nutrition. One part is mindset. And one part is recovery. So here's one of the most elite trainers of athlete performance saying one of those 4 parts is physical activity. The others are nutrition, mindset, and recovery. Is that important? So we have to have that recipe, that mixture of all those things together to really perform our best.
And when we come down to looking at exercise, because we do try to get some of the people that are listening right now, I know you might be a little timid because you've had an injury and you want to get back in, and I would highly encourage you, as we say, and many people ignore this, it's often best to check in with your healthcare provider to be at your best, so that you don't get sidelined and then have to say, I tried that and it didn't work for me. That was one piece. And as I start to see people coming back into the physical activity, especially as the seasons change, and more people go outside during spring, summer, and then into the fall, the question I had given to me before this podcast started was, What do you think of the trend of sports snacking? That's small, short, high intensity. Do you have to do all your exercise at one time to be as effective as possible? It's kind of, to me, it's like drinking. They say drink 8 ounces of eight ounce glasses for water, and you can't really drink all of them at once. You have to separate them out, and that's often best for you anyway. Can you explain to our audience the 150 minutes, does it have to all be done, in these long 30 to 60-minute spurts? What's best as you see people getting back into their routines?
Super point there. Yeah. Well, and that's why we revised the guidelines, really, because before in 2008, we said, yeah, you really should do something 10 minutes, at least 10 minutes to get the benefit. But then, we looked at the research, we looked at the evidence, and anything is good, and it all is cumulative. So exercise snacks throughout the day are wonderful. And I have some colleagues, one colleague who listened to my lecture, she has a little thing a little alarm on the clock in the wall for her area, and every hour it rings and everybody gets up and does for a couple 3 minutes every hour. And just think of squats, which is a great functional exercise, works our glutes, works our leg muscles. Just think if you did 10 squats and at the top of the hour, right? At the end of the day, you'd have done 80 squats. Or even start out with 5. You're still going to do 40 squats at the end of the day. So those little exercise snacks are very effective, and we find the effect to be cumulative, and especially when people start, because they hear that number, they hear that 150, and maybe they try and do the 150, and they get sore, and they go, "Oh man, I'm done. I'm not doing this anymore." So you're really enticing people in, and our new strength training guidelines do that for strength as well. You don't have to do 6 sets. You don't have to lift 500 pounds. Anything is good. Just getting out there and working the muscle to near fatigue even is going to get the muscle to change and do good things to get it to grow and be beneficial. So I think that's a key message, because I think sometimes people get demotivated when they think of the time. And again, strength training. Oh, I got to spend an hour and a half in the weight room. No, you don't. You don't. You can do, one day you do your arms a little bit, 15, 20 minutes. Next day you do your legs. And you can weave that exercise into your day, and the old park the car further away and climb the stairs, those minutes all add up for benefit. And so I think that's a big message that we need to get to people, that it doesn't have to be, and you don't have to go, if you like to go to a health facility, that's fine, but you don't have to. You can do a lot of this stuff very simply. You can do a lot of exercises with body weight even. Very simple resistance, tubing, the water, all those types of things are very effective. So,
I like that you brought up the water, because people that are suffering and they're listening right now has osteoarthritis or some type of arthritis that really does impact the joint. There are ways around it. Don't give yourself an excuse to say, "Oh, I have this, so I can't do that," because there's always a way, as my grandmother would always say, where there's a will, there's a way. And if you have the will to do it, today's the day. And it's just that way. It's being able to open up to finding the opportunity to maybe just modify that exercise so it fits right for you. Is there a diminished return when, say, so I used to do long distance running, and then I was told, after so much time, you're not getting the same benefit, although I still love running. What's your thought on that?
I mean, there's a sweet spot in the middle. When I deal with some ultra marathoners too, who run the 100 miles and all, and we found that even after our marathon runners, I actually teach a marathon training class, and I tell them one of the things that we educate them on is, after the marathon, kind of take it easy for a month, about 4 weeks, because that super maximal event, there's kind of a sweet spot where our immune system gets better and our risk of infection gets lower, right when we're in that middle range of exercise. When we go to those extreme ranges, like completing a marathon, our immune system gets depressed for a little while, and our risk of infection increases. So we got to give that time to, again, that recovery time. We got to give that rebuilding time in after those super maximal events. But if we're in that sweet spot in the middle, where we're not taxing our body too much, where we're getting the right amount of recovery, that's our best level of immune surveillance, where we're going to fight off infections the best. We're going to have our least amount of infections. And you don't have to do the high. I mean, if you do high intensity training is great, but you can also do high intensity training on a bike, which is low impact. And when we add weight on, that's where we see the medical problems. And I see a lot of patients in sports medicine when they're doing high intensity training with weights, and you flinging weights around and your technique falters or bad mechanics, things like that, you can hurt yourself. But there are ways of getting intensity increased without, and it's per you. So for some people, they're high intensity, maybe just walking as fast as they can. And that's totally fine. That's going to give you significant benefit to your system. So, you don't have to do the high intensity all the time. The consistency is more important than the intensity. If you want to do the intensity, it can be in a low impact fashion so it doesn't hurt and stress your joints. And we find that our walkers really get the same cardiovascular benefit as our runners. It's not that running is that much better and that much. As long as you're out there, as long as you're moving, the exercise is medicine, motion is lotion.
I think my husband is going to listen to this podcast twice because I love to run and he's like, I don't like it. I'm getting just as much effect as you are, and you're working way harder than me.
Yeah, right.
So I think it's so important because we've really done the gamut. We've taken the people that may not be as active as we really need them to get up off the couch or away from their desk. And work is work, and some of us are doing those 80-hour weeks, and we really need to blend that mental with the physical. And so you've really covered, and then you've gone all the way to the people that really do love to go out for a 3, 4, 5-hour run, and then realize there is a diminished return on how our immune system responds. Because I think people do need to recognize that when you push your body really hard, you also have to relax it just as hard and give it the right nourishment. So your friend that did the X was really quite excellent, because I now think I'm always going to think of that X now. That
Right,
exercise is really one part of it, and there's
right.
3 other parts that come along with it. So before I let you go, and I could speak to you for an easy next hour, but we're going to bring it to the close for those that are listening. When you go out and you do your exercise every day, what is the one thing that you always ensure to do because you learned it in the past and it served you well? Is there one thing that over your lifetime that maybe just could slightly adjust someone's reality that you ensure that you do so that you're the best you? Because you have a lot of weight on your shoulders too. You have an entire clinic that depends on you, and Mayo Clinic is known for excellence. So you're the cutting edge. You're the people we depend on to get it right, to be evidence-informed and evidence-based. And that sound mind is sound body. What are some of the things you do?
Well, I think the blessing is that I grew up in an active environment, and I tried, and even with our kids, and when we had dinner, instead of sitting around the dinner table, we would actually go out and walk. So we would walk around the neighborhood together, talking about the day. And so instead of sitting and talking about it, we'd be out walking and doing stuff. We hike together, we ski together, we bike together. So we do a whole mess of things. And now our girls, I remember they climbed this 7,400-foot mountain at about age 3. And it wasn't
Wow.
like we weren't forcing them, but there's a pine cone, and we would go up to it. And we did it and didn't do it hugely fast, but they did it. And now for our girls, exercise is part of who they are. It's like if they don't do it, they feel a little bad. And that's the way I am. It's not maybe the one thing, but if I'm not moving, if I'm not getting that, I'll feel it in myself that, hey, I need to get out there. Say, oh man, I had a lot of time at the computer today. I need to take a break. I need to get out there and get my movement going, because it'll really clear my mind. It'll make me set up better for the evening. I like to do a lot in kind of after work type stuff, because the work, it's a tense day, it's a busy day. You do it after work, kind of relieves all that tension, and it sets you up well for the evening. So that's a nice time that I do it as well. And again, the strength thing too, I think we can really feel when we're not doing that part of it, that our function may not be as good. So I think it's weaving it into your day. If you have a family, it's playing tag with the kids, going out and running, doing games, just getting out there and just enjoying nature, enjoying walking wherever you are, the physical environment. I think we need to get out in nature more too, because we sometimes work in these cubicles that have no windows, and we're not seeing, the beauty of what our world is. And I think when we get outside and we do stuff, and that's another, you may say, what, I need to get outside.
Yes.
If I'm inside all the time, it just gets me. And in a hospital environment, sometimes we're like that. So I really, when I get to the outside and that fresh air, it's like it's like it's a breath of fresh air in many ways for my mental state as well as my physical state.
Well said. In that forest bathing, there's a lot to it. It's the physical meeting the spiritual, and it's a time to really give yourself grace, really figure out what has inspired you, what's ahead of you, and why we're looking forwards and not backwards. And I think so many of us can get depressed because we do look back and wish I woulda, coulda, shoulda. Well, that's not the day today. That's why we're with a fabulous doctor who's given his wisdom, his time, his talents, and I'm so blessed. So blessed we got to share a meal together in Florida and really, truly enlighten the world, because you're doing the passionate portion of getting the education out. And I love to amplify a message that you so willingly give, and you give from your heart, and it shows. You're passionate about it, and you can see the impact that it makes from an evidence-informed reality. So I want to deeply thank you for keeping up the charge and making sure people are aware of how very important it is for the overall whole being care of a body to take care of it in the way to which it is doing. Last words for you. Feel free to give any shout out or any last words of advice for our listeners today.
Well, just remember the foundations. There'll always be a new thing that comes out, a sexy thing that, oh, I can just do this, or oh, I can just do that. But nothing replaces the foundations of fitness. So again, like you said, that four things. If we're active, if we're moving, if we have strength as part of our life, if we have connectedness, social connectedness, if we're managing our stress well, if we're, those types of things, those foundational elements of life are the most important, and they're better than any pill that we can give you as a physician, or they're more powerful. Exercise is medicine in so many ways, and motion is lotion to our body as well as our mind. And if we just kind of remember that, and slow and steady wins the race. Again, none of this always has to be accomplished in a day. I had one patient who was using a walker to walk. He was so out of condition. He could walk no more than 30 seconds. And we argued back, and not argue, but he's like, you can change this. No, I can't, Doc. Yes, you can. No, you can't. Well, 2 years later, he comes back, has me take a picture of him holding his pants. He had lost 250 pounds.
Wow.
So, and changed his whole life. He's now doing high mountain altitude rescue in Europe. So
Isn't that amazing?
And it's never too late to change. And those slow steps, add up. It's like climbing a mountain. How do you climb the mountain? One step at a time. And just do those basic things. And the more they add up, the more benefit you'll get.
Beautifully said. And thank you so much for joining us on Adjusted Reality. You were an inspiration. You're a motivator. I want to go out and exercise right now. But most importantly, you're looking at the human as a whole being and not just one piece. We're looking at how this all comes together and that we're doing our very best. Well, thank you so very much for joining us today.
My pleasure, Dr. McAllister. Thanks for having me.
I am so blessed that we had time with Dr. Laskowski, because he is really an individual who has been there, done that, and his wisdom is beyond the pale. It's just remarkable. So we're grateful that he was able to be one of our amazing guests this weekend.
And I gotta give a shout out to Mayo, because I work closely with them with Arizona State Sports, and like Dr. Shabra is over there, and Laskowski, he's got one, I want to meet him, so can you make that introduction?
Yes.
Two, it's amazing to see how other professionals are able to collaborate with us, and how it's not just about one system anymore. It's about collaboration, teamwork, and we've talked a lot about teamwork.
Yes.
There's no I in team, right? But we did have a question from the audience, so we do want to honor that. And one of the questions that we got was from actually an aspiring chiropractor, and they asked us, like, what advice would you give me if I'm in school? So I'll let you start that one.
As an aspiring chiropractor, I really want you to recognize what's important to you in the healing process. Because as you begin to make your way through a curriculum like that, you need to be fired up, and you need to have your intentions set so that when you graduate, your energy, your enthusiasm, and your passion is like absolutely on fire, because people really want to heal, they want to optimize, and oftentimes you're going to be alleviating some very unfortunate situations where you're the last hope. So you have to start growing and setting your intentions like right away.
And I think for me, it is get around the right people early. And, and I know that we're at a chiropractic college, but I'm going to say this on air. is that school is not just in the school. School's around you. You are the school. Like, if there's something you want to learn, go learn it. Like, go to seminars, you know, get around people that are doing it right. Go to practices, you know, don't just spend your time in the classroom. Go be in practices, go be around people that are doing it the way you want to do it, and see what's the reality of when you get out of school. And more importantly, take care of yourself. Like, you've got, like,
Yeah, absolutely.
you've got to take care of this, because if you don't, then you're going to break down, and we need you. So that's my advice.
We need you. So stick around and we'll be right back after a short break.
Short.
Welcome to Juna. We believe finding the perfect mattress starts with education, not a sales pitch. We take the time to help you figure out the perfect mattress build for you. Then our team goes to work. Every Juna is handcrafted to meet your specific needs, even per side of the bed. Rest easy, knowing you have a 120-night risk-free trial to ensure the highest quality sleep of your life. Juna Sleep Systems, you're gonna love the way you sleep. We guarantee it.